All right. Hey, class. I'm Mr. Shrum, and I am back with another anatomy lesson. We're going to pick up where we left off on the digestive system unit. And today we're going to look at accessory digestive organs, the organs that help the main digestive system. So here we can see what we're going to talk about: teeth, tongue, salivary glands, liver, gallbladder, pancreas. Now, starting with the mouth, a tooth is a hard, bony, enamel-coated structure found in the oral cavity, your mouth. Teeth are the hardest substance in the body and are used for chewing and biting. So we have these really hard, tiny pieces of enamel and bone, and that allows us to chew and bite our food. A normal adult mouth has 32 teeth, and humans have teeth that differ in structure and are adapted to handle food in different ways. So there are incisors, 8 in total. These are used for cutting and shearing food. Let's see if we can zoom in a little bit. There you go. But here you can see where the incisors are, towards the front of the mouth, where you're trying to rip up stuff. Then we have your canines or cuspids. There are 4 in total there. Those are the slightly longer and sharper looking teeth. They are for tearing as well as holding food. Then you have premolars or bicuspids, 8 total for that as well. And those are for crushing and grinding food. You can start seeing those appear right here. Incisors in the front, then you have your canines, and then you have your premolars. And then there are molars, 8 in total, for crushing and grinding food. And those are along the sides of your mouth. And then you have wisdom teeth. This is a third set of molars that erupt at about 17 to 25 years old. And sometimes if those are growing in a way that may disrupt your other teeth, a lot of people have to have them removed, wisdom teeth surgery. So yeah, I'm sure you've either heard about wisdom teeth removal or had a friend or older sibling, but it's a very normal procedure. Humans normally have 2 sets of teeth which develop in their lifetime. Deciduous teeth, the first set of teeth that erupt at about 6 months to 2.5 years old. So these are your baby teeth. And then the permanent teeth will start to replace those baby teeth during ages 6 to 17. So you'll start losing teeth around 6-ish, all the way through your teens sometimes. And then other teeth come in, such as your wisdom teeth. So those are the teeth. And then what also lies in the mouth is your tongue. It's a mass of skeletal muscle covered with mucous membrane. Just, saliva. The posterior end is attached to the hyoid bone. The underside of the tongue is connected to the floor of the mouth by the lingual frenulum. Now that's when you raise your tongue and you see that little bit of attached skin. That is the lingual frenulum. And the tongue can assist in chewing, swallowing, taste. You can taste things with the tongue. That's my favorite. use of the tongue. And then assist in speech. So some of our words and letters requires the tongue to be in a certain spot in the mouth, either touching our mouth's roof or the front of the teeth. Just try to say a few words and notice where your tongue is in regards to your mouth. So we looked at teeth, mouth, and now the salivary glands. These are digestive glands that produce saliva, spit, saliva. And saliva functions as a cleaning agent for teeth. So if you have a lot of saliva and it's coating your teeth, that is a good thing. A solution to dissolve food so it can be tasted. A solution to begin to dissolve starch, those starchy carbs, and a lubricant that contains mucus. So sometimes saliva contains mucus, and that prevents your mouth from getting too dry. Each day, about 1 to 1.5 liters of saliva is produced, primarily by 3 salivary glands. So a bottle of pop or soda pop is about 2 liters. So think of 3/4 of a soda pop bottle, and that's about the amount of saliva produced by these glands each day. So it's a lot. You just may not notice it over the course of the day. And one of those salivary glands is called the parotid gland. It is located inferior and anterior to the ear. So the ear is here, and it's just inside and in front of the ear, right there. Then we have the submandibular gland. And it's inferior to the body of the mandible, about midway along the inner side of the jaw. Sub means below, and mandibular is just referring to this mandible. So it means below the mandible. Some individuals are able to squirt saliva out of this gland. Fun fact, I guess. Sublingual gland, that is the gland underneath your tongue at the floor of the mouth. And that's all we have about that one. Sub means below, lingual means tongue, so below the tongue gland. So that is all of the mouth accessory digestive organs. Now, as we move lower in the body, we encounter the liver. It's a wedge-shaped organ located immediately below the diaphragm. It is the largest internal organ of the body. But remember, the largest external organ is your skin. But your liver receives nutrient-rich blood from the small intestine through a large vein named the portal vein. Here's a diagram. The liver has 3 primary functions: get rid of toxins, regulate your blood sugar levels, and produce bile. The liver cells, known as hepatic cells, are arranged into functional units called liver lobules. Hepatic cells comprise of about 60% of liver tissue. They create a chemical processing factory and are responsible for synthesis, storage, and release of vitamins, synthesis of blood proteins, for example, blood clotting proteins, detoxify drugs and alcohol, production of bile, which helps break down fats in the small intestine. So liver is pretty important. The other 40% of liver tissue is comprised of Kupffer cells, and these cells are security guards. They're responsible for removing old red blood cells and destroying microbes and cell debris. So 60% is made of hepatic cells, and then 40% of these Kupffer cells. Although the liver is known as an accessory organ, that does not mean that its role is not important. In fact, if your liver was damaged and unable to function, you could die within 24 hours. So liver failure is not something to mess around with. And the next organ is the gallbladder. It's a tiny pear-shaped sac-like organ attached to the inferior surface of the liver. So here, this little sac here, the green sac. The primary function of the gallbladder is to store bile, which has been produced by the liver. So bile produced in the liver is attached to this gallbladder, and it moves from the liver to that gallbladder. Now, bile is a yellowish green fluid that helps break down fats in the small intestine. And within that bile, you have bile salts, bilirubin, which is a broken down product of blood, and cholesterol. And it helps break down fats in the small intestine. The bile within the gallbladder is drained by the common bile duct. The common bile duct then drains into the hepatopancreatic ampulla, which then opens into the duodenum of the small intestine. So gallbladder, common bile duct, and the hepatopancreatic ampulla. So hepatopancreatic, if you want to break that down, that's liver to pancreas. Liver to pancreas. That's really what you want to take away from that word. Now, from the liver to the pancreas, the pancreas is a soft pistol-shaped organ. I suppose that's one way you could say it. It's a little curved. See how the stomach curves around the pancreas, and then you have that right there. It is located posterior to the stomach and level with the top of the small intestine. And the pancreas has two primary functions. One is secretes digestive enzymes that break down proteins, fats, and carbohydrates. It also produces insulin and glucagon, which are two hormones that control your blood sugar levels. So it can break down proteins, fats, carbs, and then it also produces hormones that control your blood sugar levels. So also pretty important. And that is the end of the accessory digestive organs. And now we'll talk about issues. Digestive issues. What can go wrong? plenty of things, actually. So issues associated with the digestive system may be linked to the GI tract or the accessory organs. And we'll examine a problem associated with the oral cavity, a cleft palate, a problem associated with the liver, cirrhosis of the liver, and a problem associated with the GI tract, peptic ulcers. So let's get into a cleft palate and cleft lip. So here we see a baby with a cleft palate and then a baby with a cleft lip. That's when the roof of the mouth does not completely fuse together while in the womb. Therefore, there is an opening in the roof of the mouth. Oftentimes, cleft palates are associated with cleft lips, which is when there is also a split in the lips. It's actually a pretty common birth defect. Risk factors. So what makes it more likely that cleft lips and palates occur? If your family has a history of cleft lips or cleft palates, cleft lip and palate are most common in American, Indian, and Asian children, and are least likely in Black children. Studies have found so far. Males are more likely to have a cleft lip with or without a cleft palate. Females are more likely to have a cleft palate without a cleft lip. Pregnant women who smoke or drink alcohol have a higher risk of having a baby with a cleft palate or cleft lip. So what this can tell us is that if your family has cleft lip, you're more likely to have it. Certain populations are more likely to have it. Depending on gender or sex, you may be more likely to have a certain type. And then if a person smokes or drinks or makes it riskier for their baby in any way, bad things can occur. But there is treatment for cleft palates and lips. And the goals for treating a baby with a cleft palate and or lip includes ensuring the baby can eat, breathe, speak, and hear. And another goal is to help create a normal facial appearance. Treatment for a cleft palate and cleft lip require a series of surgeries. Between 1 month to 4 months old, the cleft lip is surgically repaired. Between 5 months and 15 months old, the cleft palate is surgically repaired. Between 2 years old and 18 years old, follow-up cosmetic surgeries are performed to the lip, mouth, and nose. So first you fix the lip, then you fix the palate, and then you make the face and lips, mouth, nose appear more normal. Because a big part of having a cleft, or well, anything, any medical issue that affects the face, you want the patient to feel as normal as possible. How do you prevent it? Not all cases are preventable, actually. However, to reduce the risk of having a baby with a birth defect, such as cleft palate or cleft lip, here are the recommendations. Before conceiving and during pregnancy, taking prenatal vitamins can help lower the risk of the infant. Do not smoke or drink alcohol during pregnancy. I mean, that should be a given. I think that would be unethical, given the fact that smoking and drinking alcohol can hurt your child. That's a big no-no. And if you have a history of cleft palate and cleft lip in your family, I mean, you could always adopt. You don't have to have your own kid. That's another discussion altogether. So that was the cleft palate and lip. Now we're getting into the liver. Cirrhosis. Now, I've had a family member deal with cirrhosis. Cirrhosis is permanent damage to the liver lobules. This may be a result of a virus that causes inflammation of the liver, which is known as hepatitis. It may also be caused by chronic alcohol abuse. With repeated abuse of alcohol, the liver can be damaged. When the liver is damaged, it tries to repair itself, which leads to scar tissue. Over the years, scar tissue builds up, which decreases the liver's ability to function. The biggest risk factor for cirrhosis is alcohol abuse. Alcohol is a toxin, perhaps not as much as other substances, but it does make your liver work. The liver has to remove toxins for you to appropriately digest alcohol. And if you abuse alcohol, that can damage the liver past the point of no return. Treatment, well, first you want to treat what's actually causing cirrhosis. That may be alcohol dependency, even losing excessive body weight, and managing hepatitis with medication. So treatment involves things in your control for the most part. You don't want to be dependent on alcohol. You'll have to detox. And losing body weight is always a healthier choice for the most part. And then hepatitis, medication can help with that. And after that, you want to treat any complications that have occurred due to the disease. First step, you want to tackle what's causing it. Next step, you want to treat what's actually happening. So edema, which is excessive fluid built up in the body, high blood pressure, increased liver cancer risk. These are complications. And how do you treat them? Well, if it's very severe, hospitalization may be necessary. If the liver has lost its ability to function, a liver transplant may be the only option available. A liver transplant is when the diseased liver is replaced with a healthy liver from a deceased organ donor. Cirrhosis is the most common reason for a liver transplant. If alcohol abuse is the cause of cirrhosis, usually the individual must begin treatment for alcohol dependency. Yeah, if you've ever had a family member go through that, it's not a fun experience. But how do you prevent that? The best way is to take care of your liver as soon as possible. If you choose to drink alcohol, do so in moderation. Eat a healthy diet full of fruits, vegetables. Maintain a healthy weight because excessive body fat can damage your liver. Reduce your risk of hepatitis by not sharing needles and practicing safe sex. So, moderate alcohol if you choose to partake, healthy diet, exercise, all that jazz can help improve your liver. And then hepatitis, yeah, just don't hang around dirty people. Okay, last issue we're going to look at today is the peptic ulcers. And this occurs when the mucous membrane layer of the GI tract erodes, creating an open sore. Peptic ulcers include esophageal ulcers in the esophagus towards your throat, peptic ulcers located in the stomach, gastric ulcers, and then duodenal ulcers, peptic ulcers located in the duodenum, the upper portion of the small intestine. It was once believed that peptic ulcers were caused by eating spicy food or stress. However, now we know that most peptic ulcers are caused by a bacterial infection caused by Helicobacter pylori, or H. pylori for short. And in this diagram, it shows you the H. pylori, damaged protective mucus layer, the mucus layer. Bacteria colonize the stomach mucosa. Acid passes through weakened mucus layer, causing an ulcer. And then we have our cells and connective tissue down here. So this mucus layer gets damaged, bacteria colonize the stomach mucosa, and then acid passes through the weakened mucus layer, and that causes an ulcer, and that hurts. Yeah, pain is the most common symptom of peptic ulcers. Characteristic of abdominal pain caused by peptic ulcers include pain is worse when your stomach is actually empty. Pain gets worse at night. Pain may be relieved when eating foods that buffer stomach acid. The pain may disappear and then return for a few days or weeks. Risk factors. So, what increases the risk of these ulcers? Well, alcohol can irritate and erode the mucus lining of the stomach, which increases your risk of peptic ulcers. Alcohol also increases the amount of stomach acid your body produces. Contact with stomach acid can make the peptic ulcers worse. So you have smoking, alcohol use, and contact with stomach acid can make the ulcers worse. Treatment. Ulcers are treated with an antibiotic to kill H. pylori. Other medication may be given to help reduce the production of stomach acid, which can help relieve some of the pain and help promote healing. Antacids may also be used to neutralize stomach acids to reduce symptoms of peptic ulcers. So antibiotics to kill the H. pylori, and then medication to reduce stomach acid issues, antacids, and then pain relief. How do you prevent spreading this H. pylori? It's still unclear. It's believed that it is transmitted from person to person or through food and water. Therefore, the best way to prevent peptic ulcers is to follow these guidelines. Frequently and thoroughly washing your hands with soap and water. Eating foods that have been cooked completely. And yeah, that's a summary of all three problems we looked at today. Cleft palate and cleft lip in the mouth, cirrhosis of the liver, and peptic ulcers are all issues that may arise in the digestive system. But that's all I have for you today. I hope that was helpful, and I will see you guys later. Bye-bye.